The presentation today is Context and Responses in South Asia. And I'll just do a quick intro here. So my name is Shane Carter. I am the program coordinator for Arias, which is at UC Berkeley. I do K-12 and community college outreach programs for teachers, all focused on different international topics. So most areas of the world outside the US, that's what my programs deal with, to help American teachers primarily internationalize their teaching. And so I started doing this series called Global Views of COVID-19 during the pandemic, or, it's still during the pandemic, obviously, but when it started. And the goal was just to look at what was happening in a lot of different parts of the world and to help American educators, as we are all going through it, contextualize what's happening to you in a more global sense. It's very easy to focus on the local, right down to our own households, obviously, and that's important, but to also understand it in a broader sense. So today's presentation is with Vasundhara Sirnate, who is going to be talking about state responses to COVID-19 in South Asia. I think most of the talk is going to be focused on India, but there definitely is some on other parts of South Asia. She'll talk for about 30 minutes. And then during the talk, like I said, you can add questions to the chat box. Afterward, we'll do Q&A for another 25-ish minutes. And then there'll be a quick closing poll at the end to see how things went for you. And I'll also share with you some other resources. I would very much appreciate it if you would stick around for the closing poll, because I know as we get toward the end, people sort of drop off. But okay, I'm going to stop sharing my screen and move it over to you.
Yeah, okay, great. Okay, so I'm Vasundhara Sirnate, and thank you very much for having me on, Shane. And I'd like to start by saying I hope all of you are safe, sheltering at home. Your loved ones are all safe and healthy in this pandemic, and I hope we're all going to see the end of this soon, but I don't know when that will be. So today's presentation is about South Asia. I'm going to primarily be talking about India, Pakistan, and Bangladesh, because there are a bunch of countries there. And what I've done is I'm trying to frame this presentation not in terms of just numbers and how many people are dying or not dying or recovering. I want to try and understand what are governments doing in terms of policy, in terms of responses of the state to this pandemic, and what does this tell us about how a crisis like this is handled in South Asia, and what sort of curveballs are thrown at any sort of policy making over there. Now, this year hasn't exactly started out in the way any of us would have wanted. Late last year, this microscopic virus somehow found its way into human beings. And while we have still been unable to locate patient zero for this zoonotic disease, COVID-19, the world has, in a very short period of time, made some strides in figuring out how this virus operates and what it does to the human body. And as we speak, research is underway in multiple countries to get a vaccine for the disease on the market. And that's the plus side of things, is that there's a lot of R&D that's going into this as we speak. However, there's another side to this pandemic that I think for the first time in over 100 years, we have been able to pay attention to, primarily because there is a lot more real-time information that is available now, even more than there was 20 years ago, to say. We are now able to observe globally what countries and governments are doing in response to this pandemic, and what these responses, like I said before, reveal about governance, politics, and the nature of states. Keep in mind that pandemics have now become a perpetual condition of modern existence. All of us have already lived through the HIV and tuberculosis pandemics that are still ongoing in many parts of the world, especially in a country like India. And we have heard of SARS, MERS, swine flu, and the Ebola pandemics. Yet somehow the response to this current pandemic has been extremely different, and it has also been global in scale, which tells us two things. The first, that previous pandemics were eventually contained because there was a lot of international cooperation, lots of country governments, local state governments, and international agencies like the World Health Organization working together to stop something of this scale from contaminating the whole world. And second, perhaps we also need to look at the political leadership of that time and the global political leadership now, or lack thereof, to see what sort of containment was achieved back then and what's missing now. So, what is different about the COVID-19 pandemic? First, in previous pandemics, leadership of countries seemed to have worked effectively, like I said. For instance, I think there's a way in which the Ebola pandemic was fought in Africa, which needs a lot more attention than has been given to it. Second, there is, of course, the nature of the coronavirus itself. It's easily spread with a pretty lethal R naught, and many unknowns about the origins of the virus. Third, the initial handling of the information about this virus was less than acceptable. The world could have been warned earlier by certain governments, and some very key information about the virus was covered up in crucial days leading up to the pandemic. Even so, what we have seen with state responses to this pandemic is that there are layers to such responses. I should probably, oh, that's my South Asia map. I'm just going to put that out there so you can familiarize yourself with it. On the one hand, steps are being taken by states to fight the disease itself. And what sort of steps are these? There's building of excess capacity in hospitals, buying equipment, PPE, pulling doctors and nurses out of retirement. Then there's the research into the virus itself, the possibility of vaccines, figuring out what treatment protocols will work on very sick patients. And then there's social distancing. There are lockdowns, isolation and quarantine measures, public health awareness campaigns, the whole wash your hands in this particular way for 20 seconds and no less. There are public transport bans on public gatherings, canceling all elective surgical procedures. And all of these are measures for what we call flattening the curve, which is to make sure that the spread of the virus is slow, the rate of infection is slow, so that hospitals and public healthcare systems aren't overburdened by an influx of patients. Second, there are measures to stabilize the economy, and these take the form of aid packages, measures to stabilize businesses, and grants for people, direct cash transfers, emergency funds, food rations for those that are hungry. So finally, I'm going to come to what I find personally problematic about some of these measures, and I call these additional policies, and I'm being polite. And these involve some sleight of hand. Make no mistake, this pandemic is also being seen as an opportunity by many leaders across the world to concentrate and centralize power or push some agendas in their home countries that were facing some sort of local resistance. For instance, some states in the US have banned abortions for the duration of the pandemic. In India, the Indian government has lifted the ban on prenatal sex disclosure of fetuses. And ostensibly, these really have nothing to do with controlling the pandemic, but they're still being implemented, and we need to really be asking why. And very scarily, many governments across the world are enacting measures that seek to increase policing and digital surveillance of citizens, which also, in a way, suspend democratic rights because they infringe on privacy. And these are all termed as emergency measures to enforce quarantine. With that short and broad overview, I will get to the substance of this webinar, which is the response of South Asian states to this pandemic. Like I said before, I won't be able to cover all South Asian countries, so I will restrict myself to discussions about Pakistan, Bangladesh, and India, which not only have higher populations, but also have in South Asia the most number of cases reported. Of course, we have to keep in mind that many of these measures are being enacted at a time of great human insecurity in South Asia. A major region, Kashmir, is under a military and digital siege and continues to be heavily garrisoned, even though some internet access has been restored by the Indian government. There are fairly frequent violations of ceasefires along the line of control between India and Pakistan. There's also the issue of migration from Bangladesh into India and the plight of Rohingya refugees that managed to escape the Rohingya genocide in Myanmar between 2016 and 2019. So the main questions we need to focus on are the following. What have South Asian governments done in response to the spread of this pandemic? What challenges have these states faced in this process? And have these efforts been remotely successful in stopping this pandemic? All in all, as I will discuss, there is this perfect storm of events in South Asia, especially India, which currently has the highest number of COVID-19 cases, the most deaths due to this disease, and is also perhaps the most politically tumultuous and internally unstable country in South Asia right now. So here's some data. As you can see, I've kind of organized them by number of cases, like high to low, and India has the maximum number of cases. Note, this data is subject to change. So for instance, when I made this slide, the India deaths were 457, but now they're 480 something. So this data is going to change. But if you look at it, you can see that compared to Western European countries, the spread of the pandemic isn't that much, just by looking at the number of cases, number of deaths, and the tests that are formed. However, I have to caution you about this data, because the thing about all of these countries and their governments is that they have this extremely tenuous and fragile relationship with data and numbers. So a lot of this could be simply because they're not testing enough. And this is something that's going to keep coming up as we move forward in this discussion. And for instance, if you look at the tests per million population, India's got 220, Pakistan's got 383, Bangladesh has 117. And Maldives and Nepal seem to be doing much better on that scale, but that's also because the size of their total population is smaller. So let me move to the next slide. Right. So like I've said before, state responses to the pandemic fall into these three categories. Responses linked to stopping the spread of the disease, responses linked to stabilizing the economy, and these additional measures, emergency legislations, and policies that can erode democratic norms in a democracy. Right. So to start with, in Pakistan, here's what happened. The first cases were reported on the 26th of February. There were 2 cases. Both were students who had returned from Iran. Local transmission was confirmed by the 15th of March, and the first deaths were confirmed 3 days later. A day after those deaths, emergency measures started coming into force. There were bans on public transit. Lockdowns were implemented in Gilgit and Baltistan on March 22nd, followed by lockdowns in Sindh, Balochistan, and Punjab provinces on March 24th. Now, along with this, there were flight restrictions. Bans on public gatherings were also implemented, which has been really difficult to impose in South Asia because a lot of these gatherings are religious in nature and people don't want to seem to give them up. And along with this, in Pakistan, they identified an Islamist evangelical gathering as a super spreader, which has also been the case in India, and we'll get to that when I discuss India. And finally, $200 million are to be given as a loan by the World Bank for the pandemic in Pakistan. And just yesterday, they announced an additional $1.4 billion in emergency aid money that's going to come from the IMF. And of course, the fears in Pakistan are extremely profound. There are really there's a lack of healthcare facilities in a lot of rural areas, and I will get to that in a second. At the end of March, this is around March 31st, the Pakistani Prime Minister Imran Khan, he announced the creation of the Corona Relief Tiger Force, which focused on involving youth to distribute food and amenities, manage quarantine centers, working alongside the army and other non-governmental organizations. And in the first couple of weeks, about 600,000 youth registered for this. They also announced a 1.2 trillion Pakistani rupee economic package for low-income and small-scale industries, and also as some direct transfers to very poor people. However, when doctors started protesting about the lack of PPE in Pakistani hospitals, they had to face state brutality. Some were beaten and detained. So here are the issues with Pakistan. There's still low testing. There's a shortage of ventilators. To give you an example, Balochistan, for instance, has only 19 ventilators, and it has a local armed insurrection against the Pakistani state. So those conditions make it really difficult to kind of guarantee healthcare, because you don't know how safe your healthcare providers are. And also rural areas have limited access to hospitals. Finally, there are political differences between the center and provincial governments, which have led to uneven policy implementation. There are not enough tests, which is something you're going to be hearing from me a lot during the next 20 minutes. There's a rising dissatisfaction with the government for not doing enough or acting too late. And there's, of course, the question of resources and compliance with lockdowns in heavily populated areas. Bangladesh had a slightly different story. In early February, Bangladesh started evacuating Bangladeshi citizens from Wuhan and suspended on-arrival visas for Chinese citizens. The first confirmed cases were identified on 8th of March this year. Lockdown was initiated on the 22nd of March, and it is still in place. Flights from Europe were suspended. So these are all pretty standard things that happen across South Asia. Shut down the airports, cancel flights, stop people from certain countries from coming in because you think that those are coronavirus hotspots. So, maybe you don't want them coming into the country. Community transmission was confirmed by the 23rd of March. Now, Bangladesh has 161 million people, yet testing was initially restricted to only one center in Dhaka, which is the capital of Bangladesh. So testing again remains low. $100 million were injected by the World Bank for fighting the pandemic, and I will explain to you why. Now, Bangladesh is an economy that basically rests on primarily garment exports. The pandemic creates much economic insecurity for over 50 million workers in the informal sector, and the government has been slow to respond to their concerns. An economic package for $600 million was announced only on 25th March, and later it was increased to $8.5 billion on April 4th. The problem is the benefits from this will mostly accrue to local businesses and some to the 6 million that are involved in the garments manufacturing sector. There isn't much clarity on what will happen for the other 50 million in the informal sector. Now, food aid has been offered to those in the informal sector, but there are no direct cash transfers. And if they implemented direct cash transfers, their bill for these measures would go up by an additional 14 billion US dollars. So obviously, Bangladesh is struggling. There are fears that the Bangladesh death toll will mount in the coming months, with Amnesty International suggesting that the Rohingya refugees, which number at about 1 million in Bangladesh, could be specifically at risk. Other reports indicate a worst case scenario of 2 million deaths if there is no intervention. And this gives you the background to why all that money is being offered to Bangladeshis, so that they can ramp up all their pandemic protection measures. They can actually stop the spread of the disease without going totally bankrupt in a world where it looks like there's a global recession coming. I'm going to be discussing India next. I need to step back a little bit to provide you with a sense of what was happening in India last year in the months leading up to this pandemic. 2019 was an extremely interesting year for India. India and Pakistan were on the brink of an all-out war last February following a suicide bombing in India-administered Kashmir. That was narrowly averted, and many claimed that the surgical strike, as the Indians called it, was for political mileage for the right-wing Bharatiya Janata Party, or BJP government, because India was going to the polls in April and May last year. The military engagement seemed to have worked to obfuscate Prime Minister Modi's rather dismal economic and social track record in his first term. He held on to the prime ministership, and shortly after winning his second term in May last year, his government doubled down on Kashmir by abolishing its special status, annexing it with more boots on the ground, and imposing a long drawn-out lockdown and digital siege, which included placing political leaders and common citizens of Kashmir under house arrest or detention. Then, in December, the Indian government enacted a controversial legislation called the Citizenship Amendment Act, or the CAA as we call it. Now, what is this act? The Citizenship Amendment Act offers an expedited path to citizenship in India for religiously persecuted non-Muslim minorities from Afghanistan, Pakistan, and Bangladesh who arrived in India on or before the 31st of December 2014. So I'm just going to say that again. Essentially, this law says that if you are religiously persecuted non-Muslim person who arrived in India by the end of 2014, you can get fast-tracked onto Indian citizenship, but only if you're a persecuted non-Muslim. Arguments in favor of the Citizenship Amendment Act suggest that this is good, it's charitable. Of course, we should take care of people that have been persecuted in other countries. They also say that this does not mean that Muslims who may have arrived from these countries by that cutoff date in December 2014 cannot apply for citizenship. They can, say everybody who supports the Citizenship Amendment Act, but it's just going to take them a little bit longer. However, there is a huge problem with this assessment. First, the Act does not recognize persecution of minority Muslim groups like the Ahmadiyya in Pakistan, the Uyghurs in China, the Rohingya of Myanmar, some of whom also practice Hinduism, or the Hazara in Afghanistan that have been at the receiving end of Taliban violence forever. Second, the Act does not pay heed to Sri Lankan refugees and Tibetan Buddhists. Yet the reality is that there are immigrants from these countries in India who have fled here due to political and religious persecution or war. And finally, and very importantly, Article 14 of the Indian Constitution expressly forbids the government from making any law that discriminates against anyone on the basis of gender, sex, caste, religion, community, and creed. So this law also contradicts Article 14, which is the right to equality. So on the surface, this act may look generous to some people, but its real impact is felt when you combine it with another policy in India, which is called the National Register of Citizens. This is a policy that has thus far been implemented only in one Indian state, that is the state of Assam in Northeast India. However, the current Indian Home Minister, Amit Shah, has threatened it for the rest of India on more than one occasion. This National Register of Citizens is based on the idea of identifying and deporting suspected non-Indians from the country. Now, the primary worry that Indians have is that it will be systematically used to identify Indian Muslims and find ways of removing them from the country. Detention centers have already been constructed in Assam state and they're being built elsewhere in the country as well. We must remember also that India is an extremely hugely undocumented country. The poor don't have paperwork and they don't have the means to generate that paperwork. So essentially what the National Register of Citizens does is that it weaponizes the bureaucracy. It weaponizes paperwork against the poor because they can't produce it to show that they're Indian citizens or not. And the paperwork that you require is you need deeds to property of your grandparents. You need to show that someone, one of your ancestors was in the Indian electoral rolls dating back to 1951 or 1971. So obviously people are angry about this and Muslims believe that they will be targeted by this policy and declared non-Indian overnight. So in response to this, from December 2019 to March this year, at least 250 million Indians took to the streets to protest this law. And these are some pictures from the protest on your screen. In some areas, the protests were met with police violence. Thousands of students were detained. Universities were attacked by right-wing goons and police. Many were killed in police firing. Even so, for the most part, the protests across India remain constitutional and peaceful, channeling a strong history of Gandhian civil disobedience to what was seen as an unlawful policy, and this protest was through non-violent means. Along with this, there was tremendous amount of hate speech, some of it that came from sitting members of parliament, and it was directed at liberals and anti-government student groups, basically anyone who opposed the right-wing government. And as is often the case with online hate speech and commentary, it translated into a terrible pogrom in February this year, where 53 people were killed in New Delhi, out of which most were Muslim. To add another layer of complexity, this violence in Delhi that happened in February erupted at the same time as Donald Trump's visit to India. Now, what does all of this have to do with COVID-19? You're probably thinking, why am I going on about it? That's because the Indian government was so focused on the Trump visit, on this politicking, on the anti-CAA protests, that it kind of missed the fact that there was a pandemic coming. So it's rather obvious that at this time, no one in India, barring a few bureaucrats in the Ministry of External Affairs who were trying to evacuate Indians from Wuhan and Iran in February, paid attention to how the pandemic should be handled. The only Indian state that paid attention to the pandemic was Kerala, which is led by a man called Pinarayi Vijayan, who's the chief minister, and he's from the Communist Party of India, the Marxist faction. And this was also the state where the first case was detected on January 30th. So the central government's reaction can be described as not only slow, but also inadequate. So let me explain this. Based on what I've described, the Indian government's initial reaction to COVID-19 was to focus on evacuation of citizens from overseas, isolate and quarantine any suspected cases that might have landed in India, and use thermal detection at airports. Community transmission was established by late March, but there's this odd thing about India. There are very few cases reported in February. We're still trying to figure out why that is, but it could be because no state government except Kerala was testing widely, and that people who got sick just recovered. So honestly, we don't know why there's this gap between the first case in January 30th and then March, when the cases start actually expanding in number. There are a few competing views about what is happening in India with respect to COVID-19. First, if you look at the world map, the disease seems to have affected countries with an average temperature of 5 to 11 degrees Celsius. India doesn't fall into that bracket. However, a recent piece in National Geographic debunks that theory. Second, people have put out this idea that tuberculosis vaccinations of the BCG vaccine or exposure to malaria or use of anti-malaria drugs may have somehow slowed the spread of the disease. Now, I have to point out that this is conjecture and this is a correlation. It doesn't show that a lack of high number of COVID cases follows directly from the fact that these conditions exist. There's no causation, basically. Third, and this is kind of where I'm going with this, it could just be simply that we're just not testing enough and that cases will start climbing soon as we ramp up the testing. Now, I've seen all of these arguments made, and the third scenario leads to a worst case situation where a projected 2 million Indians could die because of pre-existing health conditions like tuberculosis, diabetes, malnutrition, and so on. And let's hope it doesn't get there, but either way, these are things worth flagging. Fourth, people are starting to argue that the Indian government's lockdown that has been in place partially since March 22nd and fully since March 24th has had the desired impact in flattening the curve, which is why we're not seeing a crazy growth in cases. However, this is where things become complicated in India. For, and this is my argument, in trying to flatten the COVID-19 curve, the Indian government basically created another humanitarian crisis. How? On March 24th, a full lockdown was announced and people panicked. They were given very little notice. There was panic buying of goods even before the Prime Minister's speech had finished airing on television. So while the massive Indian middle class began shoring up its resources for a 3-week lockdown, which has now been extended till May 3rd, the poor had fewer options. Now, India was one of the largest populations of informal labor and migrant labor anywhere in the world. What were they going to do? About 90% of the Indian labor is in the informal sector, which means they often work on minimum wage or less than minimum wage and don't have secure employment, as many are employed as seasonal workers. Many of these workers find jobs in urban areas through labor contractors and are paid on a daily wage basis. Sometimes it's less than $1 a day, and they're not paid weekly or monthly. So they work, they get paid. They don't show up, they don't make anything that day. They don't have savings or bank accounts. They often share rented rooms with others. When you get this PowerPoint, there are 2 videos here that you might want to look at. They're interesting and they tell you what happened to the migrant workers in India. Here's a picture that was taken where it's basically thousands of people trying to get some transport home to their villages from urban areas. So it's like a reverse migration of labor that's happening because they feel they will actually have food to eat and a roof over their heads if they go back to their villages. So when the lockdown was announced, the migrant labor were the worst affected. They were suddenly unemployed, but also stranded because all public transport, buses, railways were shut down. While the pandemic has killed 480 people in India, the lockdown itself has killed approximately 211 people. These include people who have committed suicide for a variety of reasons, including losing their jobs or depression. Migrant laborers have been forced to try to walk home, and some have collapsed and died of heart attacks, starvation, and the lack of medical help. And now, because the lockdown has been extended, the poor of India are staring at starvation. Some political parties in India, researchers like myself and activists and journalists are imploring the Indian government to release and distribute the buffer food stocks, which are up to the tune of 77 million tons. And we hope that public pressure will lead to this. Also, please understand that when a lockdown of this size is enforced in a country like India, there's always state brutality and violence linked to the enforcement of the policy. Another scary statistic that I came across when I was doing my research for this lecture was that abuse and violence at home increased during the lockdown. Childline India, which is like a helpline to deal with emergency child abuse cases, received 92,000 calls in the first 11 days of the lockdown. I will also flag that a massive economic package was also announced by the government appointing to 22 billion US dollars, but it's only about 1% of the GDP. And it mostly benefits low-income households which have bank accounts and can avail of direct cash transfers from the government. It doesn't address the condition of migrant workers. Even here, the state of Kerala, always the outlier in India, has done well by distributing stipulated food rations to poor households across the state. So I came across this report which was sent to me by the Stranded Workers Action Network. And they said they surveyed about 11,000 migrant workers who were transiting back to their villages. And they found that 96% surveyed had not received rations from the government, and 70% had not received any cooked food. 50% of workers had rations left for less than a day. 78% of people had less than 300 rupees, which is about $4 to $5 left with them. 89% had not been paid by their employers during the lockdown. Along with this, there has been a strong impulse in the mainstream Indian media to communalize the pandemic. While getting religious gatherings to stop, as I said before, has been very difficult in India and indeed in all South Asian countries, including Pakistan and Bangladesh. The media in India has specifically focused on one Islamist evangelical organization and termed them super spreaders because a number of people who attended this congregation did test positive. However, the spin that they've given to this is what they call Corona Jihad. That is, that Islamist clerics are asking their followers to purposefully spread the disease in India. There is no evidence for this, and a lot of this is made up. They were just people who went to a gathering, they got sick, and then they transited out. But I'm bringing this up because one of the things that has been very, very difficult to combat in India is fake news surrounding the pandemic. Online rumors, WhatsApp forwards, and news broadcasts combined with propaganda on Facebook and Twitter by ideologues of the right wing are creating a situation where pseudoscience, miracle cures, fraudulent cures are passing off as scientific research. And the anti-Muslim nature of this messaging is worrisome, as it has in the past and could in the future lead to offline real-world violence and consequences. Therefore, along with the pandemic, the vast majority of poorer Indians have to deal with a double existential threat through the violence of the state's own policies to combat the pandemic. What states have done across all cases is implement this technocratic solution of a lockdown without asking if it can actually work in a context where the density of population is that high. So the lockdown in India is its own crisis. It's a bit like monkey see, monkey do. European countries implemented it, so it must be implemented here. But lockdowns are easier to enforce in situations where people trust their government, where populations are comparatively less concentrated, and where there is a social security or benefit system which can help people tide over economic losses. All three conditions don't exist in South Asia. I will also touch very quickly on surveillance implemented during this pandemic. The Indian government launched an app for contact tracing. However, the language of the privacy agreement of the app had no fixed purpose limitation. That is, why are you taking this data? So that open-endedness in the privacy agreement is troubling because that data could be used by any government agency for anything. I've added a link to this article in my lecture notes, and when we send this to you, you will be able to read more about this. What the state hasn't done effectively in India has augmented its existing state-sponsored healthcare capacity. Tests are not free in India. They cost about 4,500 INR for a basic COVID test. Now, for many years, there's been a sustained campaign to privatize healthcare, and that obviously leaves the poor out because they can't afford to pay for private treatment. They also don't have medical insurance, although there are some schemes that cover low-income people. I think I'm running out of time, so if you have any questions, I will take them. But to finish this very quickly, the key questions and takeaways that I want you to think about is, can lockdowns work in heavily populated countries like India? What's going to happen once the lockdowns are lifted? Was this lockdown only a pause button on the pandemic? Testing is still very low for a country of 1.3 billion people in India, or 212 million in Pakistan, or 161 million in Bangladesh. Shortage of PPE and medicines expected, especially after this whole hydroxychloroquine controversy. And of course, there's intimidation of activists and journalists still underway. The Indian media has been told to report only positive stories about coronavirus. And the pandemic has been used as an excuse to step up surveillance of citizens. So those are my thoughts on this matter. I hope that it was interesting, and I stand by for questions.
It was really interesting. Thank you. So the first question, I think this is a really interesting one. You mentioned that the lockdown in that scenario, in the India scenario, but other parts of South Asia as well, might not be a feasible option just because of the built environment and population density and those things. So are there other ways that people are suggesting to manage the virus other than lockdowns?
Well, yes and no. So the lockdown has been kind of sold as this panacea that if you stay at home, everything's going to be okay. Mm-hmm. But what they could have done is they could have done it in a slightly more phased manner, and they should have known that the migrant workers were going to try to leave. And that creates another problem where there's no social distancing at all in that context. So I think a far more effective thing would have been to tell people, you can work from home, you should shelter at home if you can. If you're someone who needs assistance, here are places where you can go where you will be housed and there will be social distancing. They never did any of that. It was all very sudden. So it's like, okay, we're announcing this policy and now you just have to deal with it. So, and honestly, the lockdown policy doesn't work in the context of an urban slum in a place like Mumbai, for instance. And we're seeing cases of COVID-19 coming out of there. They could have also distributed masks to people, which I think they've tried to do in some southern Indian states. But the problem is now the frontline health workers need all the PPE. So you can't really give it to everybody, right? But if they had, now this is, of course, it's a counterfactual. If they had started the testing earlier, they could have isolated and quarantined all of these cases at the time that it was starting, because the world was warned. We knew. Kerala had already started doing it. And so the Kerala numbers are actually looking, people are actually recovering from the disease. But, okay, so I'm on two minds about this. So I know that the danger of letting everybody out on the street is that, everybody's going to get sick and the disease is going to spread rapidly. But then the lockdown is creating its own victims. So what do you do in that context, right? And to be honest, I feel like they should have really thought about it. They didn't need to have locked down the entire country. They could have locked down districts which had cases to start with. They could have actually done it in a far more targeted fashion instead of this blanket, okay, everybody, let's just shut everything down for 5 weeks and see what happens, So as an opposition leader has pointed out, I think we're just putting like a pressing pause on the pandemic. So when the lockdowns are lifted, it's all going to just hit us again.
Yeah, so you raised 2 points that I want to point people in other directions if they want to pursue. One is the earlier webinar, somebody else actually asked how China is handling the crisis differently than India. And I think another question might be about Taiwan. But rather than posing that question to you, I'm just going to direct all of you who are on this. I'll include a link for you. I think that the first webinar where people were talking about exactly what China was doing and Taiwan was doing, which were different, is useful and would help answer that question. And then the second one, where we saw the 1918 pandemic, we actually talked in that about what happens when you essentially press pause and flatten the curve for a while. Like, do you get another bump afterward? And so the presenter there went into some detail about that, so you can avoid those right now. So I want to ask you, there were a couple of questions about the tension between Muslims and Hindus, whether it's getting worse, whether it's the same as it has been. Is it just part of Modi's agenda? Is it, I mean, I guess I would ask to extend that a little bit to cover a couple of questions that I saw. Does this, do you think this is just an intersection of those things, or is it being seen as an opportunity almost? Or how do you think those two things are intersecting?
So, you mean the anti-Muslim propaganda?
The tension between Muslims and Hindus that had existed previously, and sort of Modi's handling of the...
Sure. So here's the thing. In India, when you see a riot, they're not spontaneous, they're organized. Somebody is putting a machine to work to produce Hindu-Muslim conflict, to produce Hindu-Muslim riots. And usually there are people who are linked to political parties. And we've seen that a lot recently as well. Even in February, the riots happened in areas where a BJP candidates had lost the local election. So it was like a lesson being taught to people, that, hey, you didn't vote for us? Okay, here's a riot. We're going to, give it back to you. So there's an electoral payoff to organizing a communal riot in India, which is, I think, it really changes the way we think about violence. It's not this crazy war of all against all. These are extremely organized, extremely orchestrated events. Has Hindu-Muslim rivalry tension increased? Definitely. But it's not increased because there is this animosity is natural. Like I'm saying, it's manufactured. And how is it manufactured? 24/7 news cycles which are saying the same thing. Islamic terrorists, Muslim militants, jihadis, so on. And you're hearing this on a loop on most Indian news channels 24/7. It's going to affect the way you see communities. There's fake news being peddled. One of the biggest things we're fighting in India today is fake news. And it's gotten to the point where they will literally say anything. And they will believe and they will convince people that this is what is happening. In January, there was a shooting. A man showed up with a gun and he shot someone in the arm at a protest. He was a right-wing ideologue and he wanted to reenact as a heroic figure the guy who assassinated Gandhi, who was also a right-winger. So he's like, I'm the new Godse, I'm the assassin of Gandhi, I'm going to take care of these liberals and Muslims and so on. And the news channels, this one news channel in particular, basically ran captions that blamed the shooting on the protesters, even though it was evidently clear who this man was, where he belonged to. His social media pages had already been pulled up. We knew his background, but this particular news channel just ran with another story, which was a fake narrative. And when we called it out, they finally did have the decency to apologize on live television. But it takes all that doing. How do you fight that level of fake news? So to answer your question, sure, there are tensions. I mean, people are human. They're going to get angry about the news that they see. So there are a bunch of Hindus who've never thought about Muslims badly. They're being exposed to this kind of brainwashing and propaganda. And the next day they're going to go out and, commit some sort of a hate crime against a Muslim person. And likewise, I mean, there's a limit to how much any community can tolerate. So this time when the pogrom happened in New Delhi, Muslim groups did organize and fight back. And, they said, well, this is ridiculous. You can't expect us to sit here and take it. But having said that, I mean, what gives me hope is the fact that, as I said, these protests against the Citizenship Amendment Act, 250 million people, that's a quarter of the country that stepped out knowing that they were going to be tear gassed, knowing that they could be shot, knowing that they could face pellet injuries, knowing that they could be beaten with batons and, water cannons. They stepped out in defense of the Constitution, in defense of saying that, what, we don't think like you, the right-wing government. We don't think like Modi. We don't care who someone is. Everyone's welcome to stay here because that's what India is. So there is this tension in India, and I don't think it's between Hindus and Muslims as much as it is between people who believe in that core ideal of being a secular country and those that think that India should be a Hindu homeland, a Hindu nation.
Thank you. I think that response also sort of addressed, there was a question about what is being done to confront anti-Muslim communalism. And this was about mainstream political parties, but let's come back to that. I want to ask, do you know if the virus has been as big a problem in Kashmir? And has it been responded to there politically or in practice?
Okay, I'm going to preface everything I say now by just pointing out one thing. That is that there's a lot of hollowing out of news stories that come out of Kashmir. So we really are getting a lot of our information on Kashmir from Twitter and from people through our local networks who are actually putting things out there specifically without being identified. So the situation with Kashmir is this. Yes, there are a number of COVID-19 cases, but they're also being taken care of at local level hospitals. The problem is that the hospitals, because there's been this siege, this digital siege, Kashmiris didn't even know there was a pandemic coming. Because by the time the siege is lifted, they really didn't have that information. The doctors didn't know what this was. So they've been really late at starting on that learning curve about this disease, about the pandemic, right? And a lot of us said in January, in February, in March, that you need to lift these digital restrictions because how on earth are people gonna know what's coming to hit them if they can't access the internet? because that is our primary source of information. So hospitals are not in very good shape in Kashmir. They've also been dealing with a lot of injuries because of police action in the state, to put it broadly, right? And there are a lot of mental health issues in Kashmir right now. And it is really a major cause of concern. But in terms of COVID-19 cases, there are some, but they're not that many. Again, I'm going to just raise the ghost of testing. We just don't know, because till you test, you're not going to know how bad things are. And testing isn't that much in Kashmir.
Well, I mean, the testing theme arises in every single conversation in every single place, of course. We're getting to the end of our time, so I have questions here that didn't quite get answered, unfortunately. I will email them to you you can, if you want to respond to me with some resources about them, or like a link to an article or something, that's great. And if you don't have the time, then that's okay also. And then for those of you who are on, when I send out the follow-up, I'll include Vasundhara's responses. So I'm going to close with one last question, and then I'm going to ask you guys to do the poll. And the question was, is there anything human rights organizations do in response to the treatment of migrant workers, in contrast to the upper classes or middle classes, and in response to these hate crimes and violence? But I think let's focus on the question of the migrant workers, and if there are organizations that are specifically working to address that massive population that you were talking about.
There are. And in fact, some of my friends have been very involved in raising money so that they can basically make food packets and give it to people along the way. So they're going and, they're trying to identify what routes are being taken out of urban areas. And they're standing there with like a truck, which, they're completely violating the lockdown rules. And they're standing there with a van or a truck, and they're distributing food packets and giving some cash and water. And that's really sweet. But apart from that, they've non-governmental organizations in India are also trying to set up shelters, but that becomes really problematic, because how do you enforce social distancing within those shelters? So there are a lot of community efforts that are being taken, but the most effective one that I've seen so far is a parallel organization that's collecting money and essentially just doling that money out. So it'll take £100 from me or $100 from me, and then just distribute it proportionally to someone who needs it. So people at the migrant worker level can go to a representative of this organization or this network. This is very interesting. These are networks that just come up overnight with like-minded groups. They're not registered anywhere, but they're doing really good work. And they're kind of filling in this gap, which the state isn't able to provide. So, they're kind of just going out there and doing it by themselves without any help, without any external motivation. They just like, okay, you know what, this is wrong. I want to do something about this. So I like this idea of just kind of helping people tide over. So somebody will reach out and say, I need to pay rent for next month. And they're like, how much is it? And they'll say it's X amount of rupees. And they're like, well, here it is. Good luck to you. So that kind of really, I don't know, but those are things that really touch my heart, speaking like an activist now. But it's this kindness that I think is also being seen, which perhaps I haven't touched a lot on because I've been focused so much on the state. But let's not forget that there are those people too. Not everybody's a hater. So.
Yeah, thank you. I think that's a good note for us to end on. And if you want, I mean, I'm not trying to be an advocate for any particular organization, but in the response that you send to me, if you want to send a link to anything like that, feel free. So I'm going to launch the poll for everyone. This is the end poll. And while that's up there, I just want to say thank you so much for doing this. I really appreciate it. I hope that you guys who were on the talk enjoyed it. I'm sorry that I didn't get to all of your questions, but we got to a lot of them. So
I'm happy to respond to everybody over email. My email's at the end of the PowerPoint slides.
Okay. And thank you. Okay, so I think we're done. And I will be in touch with you by email, Vasundhara,
Sure.
and the rest of you, I'll send you a follow-up on Monday.
Thank you all so much.
Thanks. Have a good night, everyone.
Thank
Bye-bye.
you. Good night.